bigger than a D cup, I'm here to tell you. So, I'm so happy you're here, and I'm going to try not to cry. I'm going to say that to the end, because I don't do that a lot, ask Rich. But I know breast cancer is a serious disease, and I will talk more about that at the end. But this is going to be a humorous look through my journey thus far. And you can imagine, though, these events, on the other hand, there's nothing funny about it. It's also been a very rough week. As you know, one of my medications caused this diarrhea, or the big D, and I will have a lot more to say about that. So, one, if I go running, please don't be offended, and you might not want to follow me in the restroom. But I have to sit, S-I-T, tonight, and I've had to get 2 rounds of IV fluid, so it's been a bit of an interesting week. But without further ado, we're going to have some laughs, and at the end, I have written a song. And now as I think about it, it should have been the Michigan Fight song, but it's an ode to diarrhea. I cannot carry a tune in a bucket, but what the hell, right? Why not? But anyways, I never use notes. Anybody that has watched me teach, I don't have lecture notes. Well, the students got them, but someone ever said, could you give us your lecture notes? You're not teaching that course anymore. They'd have been screwed. But I do have props tonight. So anyways, without further ado, let's get going. So, please, sometime though, do come by. My shoes are all boots. Literally all booties. So please notice. Don't get too close. My legs are not shaved very well. But anyway, so as you know, I have metastatic breast cancer. It's in my left breast. The tumor is behind the left nipple and goes to the, left. It pulls the left nipple in, so I have a dent in my boob, and I can see already people are going, and you see that dent? But it is there, and so I don't know if any of you all have ever watched this comedian on YouTube called Mrs. Hughes. If you haven't, you ought to look her up. And she does a whole thing about being in Canada in the winter. And you know, ladies, how it is when we go in and out of the cold. Your nipples go in and out, right? Well, my left nipple doesn't do crap. So when I go in and out of the cold, it looks like I'm signaling a right-hand turn. I'm like, oh, there you go. So I have learned that they really call metastatic breast cancer advanced breast cancer. Now, I'll just tell you, I always thought advanced meant something more than average, a positive thing. And certainly as a child, you never heard my name and the word advanced in the same sentence. We never heard, "Why, Debbie's so advanced for her age. I believe she should be advanced to grade." And I don't know in the 70s if we even had advanced placement tests and courses in high school. And if we did, I wasn't invited. But when you get older, you find out advanced means a lot more. We find out that we've advanced as far as we can in our careers. We have advancing age. We're advancing towards Social Security. And good Lord, all of our diseases are advanced. So I have advanced breast cancer, and I have finally hit the time of advancement. So we're good. I'm almost 65. I have Social Security. I'm not going to advance any further in my career, and I have the disease. So let's talk about my journey. So ladies, as you know, it started with the dreaded mammogram. And any of you who have it, you know. But did you know it's alluded to in the Bible? Actually, 2 Corinthians 4:8. We are pressed hard from all sides, but we will not be crushed. And what's with that name, mammogram? It sounds so benign, doesn't it? Because you know, in the South, they say yes, ma'am, no, ma'am, thank you, ma'am. So you think, a mammogram? It must be a benevolent letter from an elder. What they really need to do is name it appropriately. We have season squeeze, grab and smash, compress and flatten. And let's get honest, it was developed by a man. Let's get real, right, ladies? If they had to slap their boys up there between some plastic, hard plastic, we would have a whole new approach to this problem. But let's talk about the procedure itself. So, first of all, I don't even know if there's a way to prepare for it. Could you toughen your boobs up? I don't know. I could chest bump a wall. I could run into the wall. I could stand and shut them in a door a few times. I could lay on the garage floor and Rich could shut the garage door. Up and down. So you show up, they give you this cute robe. Although my friend Lorene informed me the other day, not if it's routine screening. Only those of us who have breast cancer get the cute robes. And you better open it in the front. So you go in there and you are just sure that mammogram tech, they all participate in a bet. Who can exert the most pressure and get you to sing like a sailor? It didn't take much, right? So then, she has to get you positioned. This benevolently singing woman comes in there. She puts you between two hard plastic slabs that I'm sure she just took out of the deep freeze. And she starts moving you around in ways I don't think God ever intended. So then what happens? She walks off, thinks she has you where she wants you, smashes the crap out of them. You're positive old milk is going to squeeze out. And then she decides she doesn't like how you're positioned. And she wants to put more of you in there. So she finally gets you positioned. She's going to finally go do the x-ray. And what does she say to us? Don't move like you could. But my favorite instruction is don't breathe. Like you could do that too, because your lung is in there also. So Well, lucky me, I had to have a breast biopsy. So you go in there. I don't know how many of you have had to do this, and I hope never any of you. But you have to be positioned on your back. Do you know what happens when a 64-year-old woman with D cups lays on her back? The girls go off to the side and under the armpits. I could see this very nice young interventional radiologist just looking. And the next thing I hear, we need a hoist in room 5. And then, here's a little something they don't tell you. I, of course, have to have foresight biopsy. I couldn't do it right with just one. They have to exert pressure on each one separately for 10 minutes. And she doesn't just push. She puts her hands together like she's doing CPR. And I am positive that the mammography tech taught her how to compress a boob. So we get through that, and I think, I am out of here. And they go, oh, no. You have to have another mammogram right now. I will not repeat what went through my head, but no effing way. Because they have inserted these little clips in there during the biopsy, and they got to make sure they can see them. And I thought, you put them in there, where are they? So I go and have this procedure done, and then the benevolent mammography tech decides she doesn't like the pressure dressings they have put on. And she gets an A strap and proceeds to take me from a D cup to an A cup in 2 minutes. She goes, I don't think you'll bleed or bruise now. Are you freaking kidding? I look like I did 10 rounds with Muhammad Ali, and he's dead. So I have decided, because I have to have another biopsy, they have to always monitor the biology of the tumor. Oh, goody. But this time, I will get my hands on some little blue pills, and those girls will be standing up. Yeah. So, we of course get the biopsy results, and I have to have scans. Now, I don't know how many of you have had oral and IV contrast, but it's a trip. First of all, you have to drink a liter of fluid in 45 minutes. And then you get in there and they say, we're going to give you your IV contrast. Oh, by the way, it causes a warming sensation in your hoo-ha. Do you know what happens to a 64-year-old bladder holding a liter of fluid? It is not pretty. But my sister Sue's, who's hiding in the back, we've had a good laugh of some of the commercials we see for women on TV, and those will be my next act. But I got to thinking, this could be a Poise commercial. for bladder leakage. Have you seen them? We have the one, for example, Linda has poise in the boardroom and poise in her pants. So, I'm thinking, we need an ad for the CT scanner. Here's Deb. She just drank a liter of contrast. She's handling that pressure on her bladder like a champ. She has poise in the CT scanner and poise in her pants. But I am here to tell you, if you ever looked at one of those pads, it won't just be leakage, and that pad ain't gonna hold back that flood. So, yeah. So then, oh joy, I have to have a bone biopsy of my spine. Because I couldn't again just do it right, I had to get it in my spine. So I'm thinking, okay. So first of all, now I have to have an MRI of my spine so they can hit the right spot. You ever have one of those? They stuff you in a Pringles can, tell you again not to effing move. The D-cups, I think, hit the ceiling. I thought, I need a winch to get out of here. And then the seemingly nice MRI tech said, here's the little button if you need anything. So I get in there and I went, oh yeah, I need something now. That son of a bitch doesn't work. I'm pressing it like a drug addict. Yeah, boom, 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 right? So now I'm thinking, what am I going to do? I got to calm down and get through this. And I'm thinking, we could devise several ways to murder this guy while I'm laying here. So he comes in, he goes, oh, I guess it didn't work. No shit, Sparky. Yes. So I get done, and now I'm a bit worried though about having this bone biopsy of my lower back, because here's something a lot of you don't know, except my family. I have a hairy back. And it's in the lower spine. I'm not going to show you. And it's long. So, no. Well, actually, I cinched it off with a heating pad, so I can tell you that whole story. So I'm sort of thinking, do I get Rich to shave it off? He uses an electric razor. We ain't going there with those hairs. They get all tangled up. So I think, yeah, we'll let them deal with it, right? I'm pretty sure I went to recovery with a braid down my back. But here's really what happened. You get in there, and they tell you, you gotta lay on your stomach. And I'm like, it's a male nurse. And I'm going, dude, I don't lay on these girls. So that's not gonna happen. He goes, oh honey, we're giving you Versed and fentanyl. You'll be fine. And I'm like, huh, I'll get in any position you want. But they are not happy because I have my underwear on. And I said, I was told I could wear them and you were going to work above the line. And they go, oh, don't worry, we'll take care of it. You'll be out. And I thought, thank God I don't have a tramp stamp. Although at our age, it would have fallen in the crack by now. So we get through that. it's time to meet the oncology team, who is fabulous, and I will say more about them. But we get in there, and Rich and I are thinking we're going to discuss a mammogram, a mastectomy, chemo, and I found out, oh no, you get to have letrozole and Verzenio. And I'm like, I'm going to become a TV commercial. Have you seen these commercials on TV for advanced breast cancer? We have Verzenio, which I take. We have Kisquali, and we have Ibrance. You know, they have these catchy slogans. We are relentless. Please check out my shirt. But others, we are the thrivers. It's our time for more time. And I'm like, who wants to take this stuff? And then they tell you the side effects. Low white blood cell count, liver damage, lung inflammation. It could cause irregular heartbeat, and then you could die. Well, sign me up. What I want to know is, can't someone invent medications that cause positive side effects, especially for middle-aged women? We could lose our chin hairs, could look 10 years younger, really svelte, get rid of vaginal dryness, and have your husband look like Harrison Ford. But my medications come, I get one from the neighborhood pharmacy, and the other has to be delivered. Some of y'all saw my letter to the dispatch. You know it ain't going well. Let me show you. Here's my Verzenio. I gotta put my mic down. But I have a big mouth. And all my former students know, I think patient teaching is one of the most important things we do as a nurse. So there's a little handout that comes each week in my package. It's 33 inches long. Oh, sorry, Facebook. 15 inches wide, and it's in a font of 3. And in there, you can also learn what your life expectancy is, etc. So, and also, I just ran out of time because it's been a rough week. You can make clothes out of it. Save them. I have a bunch if you need them to make summer wear. But, oh well. So, I have to go to the clinic at the Spielman every 4 weeks. So, those of you who are still teaching nursing, let me give you some advice. That nursing student that you irritate, maybe piss off, could be the one doing your breast exam several years later, and possibly could have the coldest hands that ever grabbed your boobs. Well, I do go often. I have to go every 4 weeks. Initially it was every 2. I get lab work, I have to get my boots felt up, and they haven't had this much action since my honeymoon. So, at one of the visits, we decide a prosthesis is the way to go to cover the dent, and you can't tell because I got it in, and it would be good. So I go over to the area where they measure and set the appointment, and I mentioned to the receptionist that, you know, I'm concerned people will stare at my dent. And she said, oh, honey, nobody will look. And I thought, you don't know me, because I would look. And I would spend the entire dinner meal talking to Rich, going, let's figure what happened to her. And I didn't get in more conversations in a restaurant. And then, those of us who are nurses, you know how we are. I mean, how many of us have looked at someone and thought, I could hit that vein. Look at that man's color. I don't like it. And you NICU nurses, you know how we are. We're walking around a mall going, I bet that kid was in the NICU. Although I will tell this story. Jody was across my hall from me in the college, and I was getting to really know Jody, and they were having an issue, and I'm not going to get into the pros and cons of executing someone because they couldn't get the IV in. And I went over and said, I don't really care what your stance is, but I bet a NICU nurse can hit that vein. So I got my prosthesis, wore it proudly to my next appointment. I had to get out of the hall for the exam, and my worst fear, it hit the floor. Fell out. I didn't realize it. I'm on the exam table, and there it is. A cute little flying saucer-looking thing on the floor. Now, I was happy I was alone. I couldn't move fast enough to get that thing off the floor. So, the other day, my helpful husband, I can't remember if I'm allowed to wear it for CT scans. And he goes, I don't know why you worry, it's just for decorative purposes. I'm like, dude. But when you go to the Spielman, every time you go, you have to fill out this questionnaire. They ask the same questions. Stuff like, why are you here? Don't you know you invited me? I can think of a lot of other places I would be. Do you ever have thoughts of suicide? Are you kidding me? I'm a Buckeye fan. Did you not watch the LSU Alabama game? Cool. And then they want to know, are you able to care for yourself at home? Well, I could, but I'd rather Rich treat me like a queen. Wait on me hand and foot. And then they want to know, do you need any refills? Well, I'm almost out of Angels Envy bourbon, if you can help me out. And then they always ask, do you have any other health concerns? Like vaginal health. And no matter how many times I I leave that blank, they keep asking. And so I finally had to say to them, are you kidding? Stop asking. Let's get real. That girl has been in dry dock through this whole escapade. And if you think I'm going to check for vaginal dryness, no. Because really, here's what I'm worried about. I have cancer in my spine that could break at any time. I'm thinking, okay, what are the chances? Well, I could have diarrhea. I can't predict it, or it just happens. So here's what could happen. We're in the middle of having a good time, and I hear snap, crackle, pop. Oh boy, you're not supposed to move anyone who breaks their back, right? We have to call the squad. I don't have any clothes on. So I arrived at the OSU ER, covered with a sheet, and who was going to meet me? Former male nursing students who were going to ask, Dr. Stewart, why are you here? You can't tell from the shitty grin on my husband's face? Or better yet, we'll be at it, and at the moment of sis boom bop, we're going to have shitty bang bang. But, so, I decided at my June appointment to be a good sport and have the vaginal dryness discussion. So apparently coconut oil is the best thing to use in older women. So I asked, coconut oil, liquid or solid? She goes, oh, solid is the best. I said, well, I have a jar at home. I bake with it. She said, you might want to get a new one and keep it separate. And then she informs me that really, to make it effective, you should insert it with vaginal applicators, and you can get them from Amazon. And I'm like, I wish I would have known this a couple days ago. It was Amazon Prime Day. And I know that I have nieces and nephews with Amazon Prime accounts who would like to order their Aunt Debo vaginal applicator. And I'm not going to mention names, but one of them's in the back and he has red hair. And then, what did we learn last week? Jeff Bezos thanks all the Amazon customers for paying for him to go to outer space. So I'm so happy that vaginal applicators got Jeff to space. But let's talk about Verzenio and diarrhea, or as I lovingly call it, the big D. And I will say, overall, I am tolerating the meds pretty well. But they do tell you it's going to cause diarrhea, and they weren't kidding. You know, it's in their ad, it's on the handouts. It's in the flyers. When my first round of Rosario showed up, they sent 25 pills of Imodium. I will be ready. I don't swallow pills, so we donated it to Goodwill. But here's really the reality. It causes incredible gas. I could out-fart any man in this room. And I know this is about all the graphic, right? In the big D, I never know when it's going to hit. I don't know what's coming. I have no idea. And so, we deal with it. But it has become an embarrassing issue because my bathroom activities are never quiet and ladylike anymore. I sound like St. Gabriel blowing his horn. And there are times it's not only St. Gabriel, it's his whole damn horn section. But here's the big issue. At home, they're rich, right? But what do you do in public? In a big restroom, you just figure you'll blame somebody else. But when it's a 2 or 3 seater, what are you going to do? Do you sit in there and wait for the other lady to leave? What if there's a line? Well, you just got to go for it, right? But then what's the etiquette? Do you come out of there and say, "Oh, thank goodness that wasn't as bad as the last time"? Or do you come out of there and go, "Whoop, glad I don't have to clean that out"? But here's one of the other fun things. It causes diaper rash. So at 64, yeehaw. So I peruse the baby aisle and get A&D ointment. And then my good friends, Sonia and Lorene, suggest Comocetine. It's a thick pink ointment. Pink, my favorite color. Let me tell you the problem with either product. Your body heat warms it up and it migrates forward to places it shouldn't be. So, thus began the panty liner hunt. So, there's enough of you in here to remember when the mini pads came out in the 70s, they were just straight and rectangular. Not anymore. They're contoured to fit your body. But they don't go back far enough for the diaper rash. So you position them farther back, but it then leaves part of the mini pad, the sticky side hanging out of your undies. You can only imagine what it's grabbing onto. So poor Rich is hiding. He has listened to my panty liner woes and says, because he is quite the problem solver, well, what do women do who wear a thong? Surely there's a panty liner that works for them. And I went, holy shit, there sure is. But more importantly, how did you know? And I'll be danged. They love this, but most are nurses, and I'm sorry, those of you who aren't, because I often can't tell if it's just going to be a fart or something else. I worry that I will have a wet fart or short on myself. And, you know, and I have unfortunately seen women with the telltale stain. So here's the deal, friends, and I don't trust my family, but we're going to have a code word, raisinette. If you're with me, please, God, just say raisinette. I'll take it from there. Now, I've been in some stellar restrooms. Yeah. No toilet paper. How do you get that cleaned up? It doesn't flush. The best you can do when you come out of there is go, boy, I wonder what happened. And my favorite, low water in the bowl. Now, those of you who worked with me in the college of nursing heard me more than once go, how is it in a building full of mostly women we have skid marks in the toilet? I mean, we're nurses, for God's sake. So, when you have the low water bowl in the Proscenio Big D, we have skid marks and splatter, and there's nothing I can do. I gotta look at you. I have flushed for all I'm worth. Nothing is going to happen. So now, it doesn't matter how bad I gotta go. I make sure there's TP. I check that water level. And I make sure I said flush, right? TP. I'm losing my mind. Because here's the other thing about Proscenio. And those of you who were here early, I was hauling butt through here. That stuff comes out like a rocket's been launched. And I'm telling you, NASA would get to the moon or Mars quicker. They put that in their rocket fuel. So I did decide I got to do something, have things with me, so Rich and I really can be out and about. And I tried to think, what's the best bag to do this? And ultimately, it's the backpack. But I worry that someone's going to try to take it and steal it. So, let's see what that would-be thief will win. Okay, I gotta put the mic down. Sorry, Facebook Live, and I'll show ya.
I will hold the mic for you.
Okay.
Teamwork.
You ready?
What's in that backpack, Deb?
What's in that backpack? We have disinfecting wipes, should you splatter and want to clean it up for someone.
Or yourself.
Or yourself. Oh no. We have Continental wipes to clean yourself. We have to make sure in case you're nauseated, we have a bark bag that you can use for any number of things. You might get hit without. But of course, you gotta make sure you have a roll of TP to go. You're really worried about her. If you got a diaper rash, here's Boudreaux's butt paste. Take care of it. Boudreaux's. And if you're worried about the wet farts, here's some Depends. You can just wear those. If you soil your undies, we got some granny panties for you. You're doing good.
You are chill. These are nice. Can I have these?
Yeah, you can have them. You got them at an antique store. You better wash them. We also got poopery because you want to be polite to your people you're robbing next. In case you've used Boudreaux's butt paste, you might need a super absorbent Kotex to protect your drawers. Should you happen to stop up someone's toilet, here's a plunger. And, you know, I can't swallow pills, so you might need a jug of liquid Imodium to help you get through it. And if you're worried about getting anything on your hands, you should put some gloves on. Your local veterinarian who examines cows will be glad to help you out. Thank you so much. You've been a good helper. So, and we are close to done here. We're at the other day, Rich and I are at an antique mall out I-70, and the Verzenio rocket is ready to launch. So I go flying into the restroom, and it's a 3-seater. Oh, joy. But there's a lady in the first seat, so I think, I'm thinking, okay, polite social distancing. I'll go in the third stall. Because really, don't you just hate it when there's an empty stall and they got to sit next to you? Well, she is on her phone. And I'm trying to hang on for all I know. But we had counted down to 0. Boom. I'm thinking, really? Are you kidding me? So she leaves. And I'm thinking, oh, good. So I'm getting things out of my backpack to take care of the situation. And the maintenance man comes in. Maintenance? Just a minute, please. And he proceeds to fill the towel holder while I'm applying A&D ointment to my diaper rash. Oh my God. This past weekend, Rich and I are in, we've learned it's Worcester and not Wooster. We're at a nice little country restaurant, and I gotta go. I get to the women's restroom. It's a 1-seater that's big enough for people to wait. And I'm like, it ain't gonna happen. So we haul it to McDonald's. And he is, you know, he's always a problem solver, and he's looking for the best space, and I'm like, park the damn car. So I go running in, and I need to clean up, and I normally dispose of these things. You know, women, we have sanitary napkins or feminine hygiene disposable trash cans. It's full. And I'm like, you know what, McDonald's, I hate to do this to you, but I'm flushing all of it. Now, if I'm at your house, I do carry little disposable bags, so I can dispose of things properly and not clog your toilet. Well, thank God I didn't wait and use one of those, because I come back out into the restroom to wash my hands, and there's no running water. And there's no trash can to throw anything away, because I now have soap on my hands that I have to get off with towels in my bag. And I'm thinking, oh my God, if I had used one of those disposal bags, I'd have had to go out in the restaurant and find the trash can to get rid of it. Oh no. And so it has been a rough week. And at the clinic, by the way, at the James, they have a clinic, an acute care clinic just for cancer patients, which is just fabulous. But they want a specimen. And you can't just put it in one container. Oh no. They want it split between 3. And it has to be liquid. And you have to fill it to a certain line. Oh my God. That's NICU nurses we had made. So of course, who can poop on demand? So we take it all home. And the very nice nursing assistant gives you one of those, I don't know what it is, it looks like an upside down hat. And she says, now don't pee in it, just poop. I'm like, oh, okay. She goes, push it as far back in the bowl as you can go. I'm like, oh, okay. I never really thought about the size of it till I needed it. Now, for those of you who've been to my house, I have a 1950s Mamie Eisenhower pink toilet, and that thing took up almost the whole bowl, and there was no way urine wasn't going in that container. Well, I go, and I won't be too graphic, but I come out and I go, oh, Rich, and we discuss it, and we're both like, cancer patients would love to see that consistency, so it got flushed. There's no specimen yet. But I'm going to end this with a song. And again, I can't sing, but this is for me and all the other cancer patients who have to deal with the big D. This is my ode to the big D. We'll see if I keep up with it. Oh, can you start it over? Sorry. I take Lucinia for cancer. It causes lots of side effects. Diarrhea is a gas, a real pain in the ass. God let me not poop myself. God, let me not prove myself. If I'm too weak, please just ignore. If I am leaking, get me out the door. 'Cause I get the big D in the morning, and I get it all throughout the day. I have to hydrate, bourbon must sway. Let me not poop, let me not poop. Please, God, let me not poop myself. So there you go. But yeah, so I know poor Rich was listening to a ton of renditions of that. But in the end of the day, the fun part's over now. But I do have breast cancer. It is advanced, and there is no cure for that. The commercials that I laugh about, there's nothing funny or helpful actually about those. You know, they put median time for life expectancy, median time for disease progression, so they are not comforting to me. But the people at the clinic, and I gotta tell you, from my oncologist to the PCAs, they're the most fabulous team of people. And we watched them care for my sister first, who's in the back, Sue's, and I just can't brag enough about the Spielman Center. But they assure me that they have women who are 10 and 15 years out, and that's my goal. I will be here, God willing. And I do carry a backpack. It's a lot prettier, but I'm not really trolling to be invited to your house, except Bonnie and Mike gone. I'm looking forward to Deck Day. I hope you know the Minnesota games at 8. But I do worry about coming to your home and making a mess. But I do have everything I need. And I will clean at your house, just not in public. But they are things that Rich and I do have to think about when we leave the house. And as you know, I was diagnosed really in December, and I've had to do a lot of it alone because of COVID, and don't even get me started about that. But he has been there for me, and I couldn't do this journey without Rich and this poor guy. Here's how a lot of our conversations go. I don't know, do you think this is diarrhea? And then I describe it. But he has hung in there, he problem solves with me because there is nothing funny about a mammogram. And at the time, I was having horrible back spasms. I could not move. And I thought, if this is the best I will be, this is going to be trouble. But they're better. The medications are working. I had scans Monday, and they are good. So the best part, the tumor is shrinking, so it's all good. My family who was hiding in the back because they're not on time, but I can't do it without them. Yeah, I'm never on time. Well, I'm Buckeye game. I'm there, but never. But they're there too. And they have stood by me through this. We watched my sister Sue's fight this battle, but she is cured, and we are blessed to have that happen. I will tell you, we just assumed I would have a mastectomy and I was going to do a double, that I would have chemo. I wasn't going to get a wig. I thought I'll just sport the ball. But I learned that I wasn't going to lose my hair like she did, and I believe her comment was, well, bitch. But it's all good. So, and I can't do it without you guys. You know, my friends and support, and you gotta have, it takes all of us. And I know breast cancer has touched a lot of people in this room, and other types of cancer, and it's a relentless, I got it on my shirt, relentless disease. But the other thing I want to acknowledge is that this was not just for me. Part of the money is going to children's for brain tumor. Those of you who know Linda Daly and her husband Dave, it's her granddaughter, little Ryan, who's 3, has come through this like a champ. She has fought. She is an inspiration to me. We were really diagnosed within, I bet, 2 weeks of each other. We both had scans this week. We're kind of fighting it together, but we're doing it. And so that little 3-year-old is an inspiration to me. And so, anyway, I thank you for coming. It's so meaningful to me, and so all of our proceeds and any donation will get half to Spielman and half to children's in Ryan's name. And so I'll probably end here because I don't want to cry. But this has been hard. And here's my last message, and Susan would say the same thing. Ladies, if they offer you genetic testing, you take it. Susan and I had some of this, pretty much the same genetic workup, and our tumors have different biology. We lost a grandmother to breast cancer who we never met. Our mother fought this disease when we're trying to think, I was maybe 7. And we shudder to think there were 6 kids at that time if we had lost her. We don't know the biology of her tumors. But Susan was telling me that the Kardashians, Jesus, apparently did genetic testing on TV, and they didn't have the BRCA gene. Well, neither do we, and we have breast cancer. So do it, do it, do it. And I think I will leave it there. So thank you so much.